We are certainly right now in this country out of the pandemic phase. Namely, we don't have
the country's top infectious disease expert today saying the U.S. is moving on from the coronavirus pandemic. But Hawaii leaders warn we're not in the clear just yet. The state's lived with COVID-19 for the past 2 years and infection rates continue to go up and down. Now Hawaii is making the switch from emergency response to disease management. But while the state is changing the way it deals with COVID, KITV4's Paul Drews reports it doesn't mean Hawaii is out of the pandemic just yet, right, Paul?
Not only do health experts expect us to be in this pandemic for quite a while, they have also told us that they expect things to get worse than they currently are, with COVID infections and hospitalizations going up.
COVID infections are up nationwide, and they are up here in Hawaii. Our current daily average reported case count is 362, representing a fourfold increase from a low of 88 cases per day on March 18th.
Some believe Hawaii's COVID daily case counts are actually much higher because many people are using home tests and those results are not reported to the state. Dr. Tim Brown with the University of Hawaii said a better indicator is the rate of positive tests out of all of those taken.
That is clearly still on a rather rapid upswing, actually, if you look at that over time. So that's what concerns me. That means that we're still seeing pretty substantial spread of COVID in the community.
Rising numbers show Hawaii is still in this pandemic.
We are still very much in it. We're still seeing ongoing global uncontrolled transmission of COVID-19, and we're still seeing emergence of yet new variant strains.
But what is changing is the way the state deals with this pandemic, transitioning from an emergency response to one of managing a health issue.
As part of the transition, COVID will be handled more like other diseases, something healthcare providers diagnose and treat.
Part of the change comes from federal funds drying up to pay for programs, others because they weren't found to be most effective. That means mass testing sites are gone, as much of COVID testing is now done at doctors' offices and at home. Department of Health contract tracers will also go back to other jobs because it was found that contact tracing is not the best method to control this virus. Instead, the state wants to get the message out that people should take preventative measures like vaccines and boosters and seek medical help quickly if they do become sick. Meanwhile, recent COVID hospitalizations have also gone up, and some health experts believe they'll go up even more.
Hospitalization is a lagging indicator. It only starts to go up 2 to 3 weeks after the infections have already occurred. So we're looking at that earlier part of the curve, the positivity curve, when the positivity was still probably back at, 2-3%. And now we're talking about something like 9%. Those hospitalizations are almost certainly going to rise over the next several weeks.
As the state transitions in the way it deals with COVID, many wonder how long this pandemic will go on, at least into next year, according to Dr. Kemble.
COVID has surprised us at every turn. So when we begin to see, let's say we get through another respiratory disease season, a winter respiratory disease season, and we don't see a major hit on the hospitals, we don't see a dramatic rise in deaths, that is the transition into endemicity. I wish I had a method.
Now, some things will change as the state transitions its approach to the pandemic, including stepping up the monitoring of our wastewater to spot signs of COVID before clusters break out, while other things will stay the same as the Department of Health plans to keep watch for new variants as the virus mutates. Paul Drews, KITV4 Island News.